Hi everyone, my name is Sophie and I'm the host of our video series for COVID-19. Today's guest is Dr. Jacob Warren. He's the Endowed Chair and Director of the Center for Rural Health and Health Disparities in the Mercer University School of Medicine. Hi Jacob, how are you?
I'm doing well, Sophie. How are you doing today?
Great, thank you. So, rural health is not something that I know much about, and that's obviously your specialty. So, I would love for you to talk to our listeners about your background and what rural health actually is.
Sure. So, the interesting thing that's been going on with this outbreak is it's really brought rural to the forefront for a lot of people. And what people don't necessarily realize is that healthcare doesn't play out the same way in rural communities as it does in urban areas. So what we see in rural communities is lower access to healthcare in the first place, which is sort of where everything else builds from that I'm going to talk about. So we have fewer providers that are available in rural areas. Patients just can't get to them. We have some rural communities in the United States, the entire county has no medical provider whatsoever. So you have a complete care desert in many areas. So that was an issue before all of this. And then, of course, this has brought this to the forefront in terms of how that creates challenges. But beyond the general availability of care, there's also issues with accessibility. So rural areas have higher rates of poverty, higher rates of uninsurance, increased shift work that doesn't provide for paid time off. And so even if someone has a medical provider in their area, you don't have the same ability to access that provider. And then there's also issues with acceptability in rural care, and this particularly applies with mental health, where there's increased stigma in rural communities surrounding seeking mental health, and there's also at the same time increased visibility of services. So in rural communities, we always say everybody knows everybody's business because it's a small community, everybody knows what car you drive, and if your car is parked in the psychologist's parking lot, everybody knows you're receiving mental health treatment. So there's some that can play in as well. So you have those three big barriers of availability, accessibility, and acceptability of care that play out. And we're seeing those factors unfortunately impact response to COVID as well.
Mm-hmm. And we'll get into the impact of COVID a bit more in a second, but I'd love to know why you chose to specialize in this area and what kind of role you have at the moment.
See, it's personal and professional at the same time. So when I was a kid, we moved around a lot. So I was born near Metro Atlanta, one of the most urban areas we have. But throughout my childhood, I lived in places that had 200-300 people and no traffic lights. So I've seen both sides of it, and getting to experience that sort of gives me a unique angle on both sides of it. So there's people who grew up purely rural and people who grew up purely urban. I've had a bit of both, and I've seen the things that urban does well and that rural does well and things that we just could improve on. And that really is what drove a lot of it. And early in my career, I started focusing in the field of health equity. And there wasn't a lot of work being done in rural health equity at the time. It's getting more attention now, but there's just so much that needs to be done. And it involves intersectional risk. So we have the same issues of health equity with racial and ethnic disparities that layer on top of rural. And that's really what got me motivated to get into the process. I do want to throw in one other positive, though, is that working with rural communities is amazing. And I hope we get a chance to talk about this a little later, but the innovative solutions that rural populations come up with, because they're always tasked with doing more with less. So they come up with the most amazing ideas that you would never think of on your own. And so that's another really energizing part of working with rural communities. So I do a lot of community-based work. I describe myself as a community-based researcher. So it's all about what does the community want to do and how can I help? It's not coming in from a university saying, I'm here to help. This is what you need to do. That's not how we do things at all. It's about learning about what communities want to do and helping them achieve those goals.
Oh, that is exciting. Okay, well, let's move on to talking about some of the challenges that people in rural populations are facing at the moment in relation to COVID-19.
So what we're seeing a lot, unfortunately, is it's exposing the fragility of the healthcare system in rural communities. So as I mentioned before, some rural areas have no providers whatsoever. So obviously that creates a complete care vacuum in the middle of one of the largest health crises we've ever seen. But on the other side, it exposes the fact that if you have one provider and that one provider becomes exposed, and even if they don't become infected, if they have to self-quarantine for 10 days, you've just lost medical care in that community because of one provider. And the other aspect relates back to the cost of care is much higher in rural communities because you don't get those economies of scale. You don't have sort of an endless patient volume. And so if you see the downturns that we've seen in people coming in for non-essential quote unquote services, the cash flow issues we're seeing are just layering on to what we already knew was a problem. So rural hospital closures are a major issue. We had over half of hospitals in rural America operating on a negative margin before the pandemic. And so there's just a lot of financial issues playing out in addition to just trying to, take care of people in the way they need to be taken care of. So those are some of the big challenges that we're seeing.
Yeah, wow. I mean, I can't even begin to think about how somebody could overcome those challenges. So I would love to know, is there anything that people at home who are watching this can do to try to access the care that they need, or is there anything that you can offer in terms of support or resources or guidance around how they can get support with these challenges?
Well, that's one of the great things that has come out of all of this is we've seen this shift in urban toward telehealth models. And the model itself of telehealth was developed to address the needs of rural communities because it hits those availability and accessibility issues. And so a lot of the policy changes that have happened are actually things we've been calling for in rural health for decades, saying if you would just pay providers to provide telehealth encounters, if you would let someone be seen from their home, it addresses our transportation barriers. I can be seen by a physician 100 miles away. So the advancements in telehealth has been really incredible to see because everyone is realizing, wait, this does solve a core issue in our healthcare system, and it's one that has been crippling rural America for a long time. So that's the big piece, is just knowing that telehealth is here now and we can use it, and that it doesn't have to be video, because at the same time we talk about telehealth a lot, we focus on broadband in rural America, and we have broadband access issues, absolutely, but you can have a telehealth encounter via telephone. And so as long as you have a cell service, you don't have to think, well, I don't have high-speed internet, I can't do a telehealth encounter. Yes, you can. You can still do it through telephone, use the technology that you have available. That's the big message I'd like people to know.
Great. And so what if somebody is a bit technically challenged and they don't really know how they can access that kind of service, or they're not sure if the clinic, where would they even go? Especially considering that if it's telehealth, it could be anywhere. Are there certain rules or processes that they would need to follow, based on their location, or how would they go about finding someone to consult with?
And part of what it does play into a challenge that we have, because if you don't already have a primary care provider, it does open up that question of where do we go. But a lot of providers are being more open to new intakes at the same time. So if you don't have one in your local community, to find someone nearby. So it is just a matter of reaching out. People are being very progressive and open in the way that they're seeing new patients, realizing what's happening. So I think the key is just reaching out, finding someone in your county, a local county, someone that can find that for you.
Mm-hmm. Okay, well, we still have quite a bit of time left, so I'm wondering, what else would you like to discuss or share with people who maybe are stuck in a rural type environment and struggling at the moment?
I think one of the big pieces is, I think there are many things we can learn from rural communities about how to respond and how to stay positive in all of this. So one piece is about the importance of family and community. We know that rural communities overall tend to be more collectivistic than the rest of the country, for instance. Mm-hmm. And so realizing the importance of that and getting back to whether it's your family of origin or your family of choice, being sure we're maintaining those social connections. It's one of those unfortunate misnomers to everything that we've been doing, that we're calling it social distancing, and it's physical distancing we need to be practicing, not social distancing. And so being sure that we're not losing those social aspects. And so, knowing the importance of community, and technology is a great tool for that. It's how we're communicating right now and still able to do this. And so figuring out how to use video conferencing, phones, again, whatever is available, to try and really aspect that. So I've heard of families doing Sunday dinner via Zoom. So everybody cooks the same meal and they sit down together with their computers, and it's just like you're sitting down to Sunday dinner. So it's a way to maintain that sense of normalcy and connection, even though we can't be together at this time. And so that I think that's getting highlighted for a lot of people, that we miss our our families, whatever we used to define family.
Yeah, absolutely. And I know a friend of mine was organizing like an online dinner thing as well, and he was like, "I'll send you all the ingredients and the recipes, and we'll all make it at home, and we'll just be on Skype or something." And yeah, it is an opportunity to try new things, and I think it's also an opportunity to not be as perfectionistic in how you go about things. So we already talked about, what if you don't have video call technology, or your broadband isn't strong enough for that? Then, moving on to a telephone call, it still achieves the same goal. It might not be what you're used to, but, I think it is about being flexible and adaptable and trying to learn new ways of doing things. Even like, I don't know, how is the grocery delivery thing being handled in rural communities?
I'm glad you brought that up, because that's another thing that we've seen with innovative solutions I mentioned before, where rural finds a way. They always find a way. So a lot of the grocery stores don't have delivery services available, or you might be in a food desert. A lot of rural communities don't have grocery stores at all. And so what we've seen is communities coming together to say, this is a problem, how do we address it? So there's a community here in rural Georgia where it's not exactly the food side of it, but police officers have started delivering prescriptions because the pharmacies don't have delivery services. And so the police officers have said, well, we'll do that while we're making our rounds to the communities. We'll find out who needs prescriptions and fill those and bring them to you. And there have been a lot of communities, too, where college students who've had to go home have now taken this on as part of what they want to do. It's part of their service learning. So we'll do food delivery. So who are the seniors in the neighborhood? Who are those who don't have public transportation or don't have transportation at all because we don't have public transportation in the first place? So how do we connect those people in need? And that's been a really great thing to see, because that's, again, that community aspect I mentioned before. This is what rural does. They say, yes, there's a problem, and we're going to have to solve it because no one comes in and solves this for us. That's what rural communities are used to doing. And so seeing those communities come together to do that. Another thing, and it's a way to give people purpose at this time, because I know a lot of people feel kind of rudderless. People have started to make masks for essential workers. That's something that can do. It occupies time, gives a sense of purpose. It can also be very grounding at the same time. It's a very physical, tactile process. You've accomplished something, right? I've made this mask. I've given it to someone. It gives us that purpose. So we're seeing a lot of that I think, across the board, but also in rural.
Yeah, I can really see how it would make sense that someone working in this field should have experience living in a rural community. Because like you said, for people who've always been in a city, or they've always had access to public transport, and they've always had online deliveries, and they've always had broadband, it's really hard to put yourself in the shoes of, well, what do I have available to me? What would I do if I was in that situation? If you've never been in that situation, you don't really know what you would do. And if you're not sort of faced with that, oh, well, if I don't figure it out myself and find a way, I won't be able to access this thing. So, yeah, I think we've seen similar things in terms of how businesses are run, like having to shift things online and changing the way that they're delivering something or offering something. Or just accessing it for free during a period of time until they can kind of figure things out. But yeah, the pivoting is so critical right now, especially because we don't know how long this is going to last.
Mm-hmm. And that's, like you mentioned, it's hard for a lot of us, but dropping that perfection piece of we're not going to be able to do everything exactly like we did before, so it's okay, and let's figure out another way to get that goal, exactly like you mentioned.
Mm-hmm. And do you think that some of these shifts and innovations and things that rural communities are able to come up with, do you think that will be a lasting change? Do you think that people in more populated areas will start to incorporate more of those strategies and maybe make more allowances for people who are in rural areas?
I hope so. I really do hope that's part of the positivity that comes out of all this. There's been a lot of focus, understandably, on what is life going to be like after this, and it's never going to be the same. And in some ways, that means we can make things better. So like these changes we made with telehealth, they're all set to expire because they're temporarily put in place on an emergency basis. But if we can get everyone to realize, look, this solved healthcare for so many people who are underserved, not just rural, but urban, no matter where you are. If I don't have transportation, if I'm a senior, if I live in a rural area, whatever it is, now I can access care. And that's one of the most basic things that we should have. And so this lets us say, okay, we did it. We might have done it because we had to, but now let's see how we can continue this moving forward. And I hope too it does allow, like you mentioned, it gives people a little snapshot of what it's like outside of their own world. And so to let people see, this is why this is important to do in rural. It's not just, it makes it more convenient in an urban. It might be the only way you're able to do something in rural. And so let's look at how we keep this innovation going.
Yeah. I wonder if there's a way that people who are suddenly accessing care or experiencing a benefit of a shift that's happening in the pandemic, is there a way for them to kind of express gratitude or publicly say, this has been really helpful, we need for this to stick around? I'm wondering, do you know of anything like that where people can kind of advocate for things to change permanently?
I think that's a great thing to do. A lot of this is set by our legislators. And so if people who have been touched by that in ways that they've never been able to access care before, if they can get that out to their local legislators, their state legislators, their national legislators, and say, look, this is what it did for me. It's been amazing. Thank you for doing this. Let's keep it going. Because not everyone's going to see the way it impacts people. And so I think giving that a very visible presence is important.
Yeah, absolutely. We have a couple of minutes left. Is there anything else that you would like to share or mention, or are there any places where you want to direct people for more information?
I think the last thing I'd want to mention is about resiliency. We've talked about it a little, that rural communities are very resilient. I think it's something that we all need to be focusing on right now too, is how do we build our resiliency? Because as you mentioned, we don't know how long this is going to go on, and we have to sort of operate from a this is the new normal perspective, so that when it's over, we're thrilled to be going back, not just dragging along until we can survive through, which is where a lot of people are, understandably, but we've got to keep that long part going. And so in thinking about the resiliency aspect of trying to be sure that in the midst of all this, we're doing what rural communities do, which is look at what do we have. It's really easy to focus on what we don't have right now. And for a lot of people, they are really struggling. And so it's very difficult to look past what they don't have. But just from a general mental health perspective, we know how important it is to find something every day just to be grateful for. One thing, one small thing that can anchor you in the middle of all this is the one thing that went right today, or that I know is something that helps me get through the day. And at the same time, doing a little bit of self-care. It's not a 2-hour spa day. We're not in that space right now, but even if it's just reading 5 pages of a book, taking 5 minutes to say, this is my time right now. I have to do something for me to maintain my ability to support the others who need support. And so keeping that in mind, just the resiliency aspect and a little bit of gratefulness. And when you do find those moments of joy, which sometimes seem fewer and far between right now, of really savoring them, of acknowledging what a great moment I just had, and I'm going to hang on to that for a little while because I might need it to get through the next day, but this was something really good. And so that resiliency and gratefulness piece, I think, is something that helps people in normal times, and especially now it's really important to keep anchored.
Yeah, absolutely. And I think it's nice how we're kind of all noticing the smaller things now that we took for granted before, like even just the fact that I have a roommate and we have a cat. I just feel so lucky that I've got, them around me, because it really helps with my energy levels, and just knowing there's someone there if I really want to talk to someone or have a hug or something. But everybody's got a different version of that. Some people might have kids where the kids are like laughing and joking, they don't really understand what's going on, and it helps to take the stress out of things. Or I don't know, they have a gym at home that they already had, so now they can use it, and everyone else has to not go to the gym. But yeah, I mean, I think everybody has some things like that where they're like, wow, I'm so lucky that I've got these things. And especially like we were saying earlier, if you're in a rural community and you don't know if these changes are going to be permanent or if they're just during the pandemic, then make the most of them and express the gratitude now, so that hopefully there will be more permanent changes that get made.
Absolutely.
Well, thank you so much, Jacob, for being with us today. I've learned a lot, and I'm sure that others will too.
Oh, thank you so much, Sophie. It's been a pleasure.